All right, thank you for the opportunity to present this this work. Nice to see everyone today. Nancy, I want to thank you for my safety education over the years. I'm still very junior here in this, but and I also want to let everybody know that we didn't get a chance to go over this presentation in detail. So if I misspeak about anything particularly related to STPA or STAMP, Nancy or anyone else, feel free to correct me along the way. And then lastly, before I get going, big shout out, thank you to Lawrence for kind of going through and working through some of the details of this presentation. So thank you, Lawrence. So the outline for the presentation, I'm going to walk through an example of FMEA and STPA looking at the same process. It's going to be a simple process that's not specific to healthcare, because what I'm trying to do is understand for myself, actually, and if it spurs some conversation, that would be great as well, about the differences between FMEA and STPA. And then I'll talk about some of the specific research in radiation oncology related to FMEA and STPA, and then draw some general conclusions from that previous work and mention where we want to go next with this type of safety research. So we're going to start with a piece of equipment or a process. That's the goal here. So the process that we're going to start analyzing is these two boys surfing off the bed. What are the safety concerns with this particular process? And first thing we do in an FMEA is describe the equipment or process. So we describe the process here with a process map, which we all know is just a well-defined sequence of steps and decisions that need to be made. One of the key things to point out here is that the process map is very specific to the time order. It's explicitly stated what happens first, what happens next, and when decisions are made in order to complete the process. So for this particular process, a process map might look like this, where we have a beginning, the boys grab the board, they get on the bed, they position their surfboard, they lean forward, and then the boys surf off the bed. And that describes, in terms of process mapping in FMEA, describes this process. So the next step in an FMEA is to pick one of these steps in the process and do an analysis, do a deeper analysis on that. So you can typically start with a process step that is, you think would contain the most error. So boys surfing off the bed is where all the action is. So that's what we're going to analyze here with this FMEA. So we start by asking ourselves what could go wrong, and then you brainstorm or come up with ways that could happen and what the resultant accident would be. So here are three of them. The surfboard slips out and the boy hits his head. The boy lands on the surfboard but falls and skins his knee, or one brother can knock the other off the bed and bruise his wrist. Now you take one of these and you dive into a deeper analysis. So we're going to dive into surfboard slips out from underneath the boy and he hits his head. And we ask ourselves some questions. So how severe would it be? Where 10 is the most severe, like death, and 1 is no severity at all. So in this case, we could say if the boys hit their head, they're probably not going to kill themselves. They could end up with a concussion. So we'll pick an 8 out of 10 for that. Next question, we ask, what is the likelihood that this will occur? And we're specifically talking about this type of accident. Surfboard slips out from the boy and he hits his head. 10 is it's guaranteed that it's going to happen. 1 means it's guaranteed it's not going to happen. And so in this scenario, looking at the boys, knowing boys are quite active, you can imagine it's at least 50-50 or maybe a little bit better that this accident could happen. So we'll give it a 6 out of 10. And the last question we ask ourselves, what is the likelihood that we can detect and prevent this from happening, where 10 is a very low likelihood that we can detect and prevent it. And seeing where the parent or guardian is standing from where they took this picture, there's probably not a very good chance that even if they saw the boys falling and hit their head, that they could actually stop it from happening. So we're going to say it's a relatively low likelihood, which means a high number. We'll give it a 9 out of 10. So summarizing, what could go wrong? We're analyzing surfboard slips out from underneath him and he hits his head. How severe would it be? 8 out of 10. Likelihood 6. likelihood that we can detect and prevent it is 9. And this is essentially an FMEA, where that first line describes the failure mode. Then we have severity, likelihood will occur is occurrence, and then detect and prevent it is detectability. Next steps are to multiply those 3 numbers together, severity, occurrence, detectability, and get a risk priority number. So in our case, 432 is the risk priority number. In an absolute sense, that number has no meaning, but what one does is go back and do the same exercise for all the other failure modes, and then you rank those failure modes and take action on the highest RPN values. That's kind of the gist of it. And in this case, you can see the parent in their head must have done an FMEA, and they put some pillows there. And so that is, in FMEA speak, a safety improvement exercise. And I mentioned the pillows here because, at least from in my non-safety expert clinician experience in doing FMEAs, what you tend to find is at the end of the analysis is the best thing to do is put another checklist in place, or a timeout, or some other safety barrier at the point of attack. That's what this tends to lead one to, and so pillows are exactly that. So let's move on to STPA and analyze the same process. I put an asterisk here because the next few slides are a pretty significant oversimplification of the full STPA procedure, but I wanted to keep it as simple and straightforward as possible so that we can get through it quickly enough so that we still have FMEA fresh in our mind, and we can kind of draw some general conclusions about how the 2 prospective safety assessment approaches work. In STPA, you also describe, in this case, the process. We don't use a process map. We use a series of control loops, which you see there on the right. I know we've heard about all those, heard about these today already, so we don't need to go into too much detail, except to say that we have that controller who issues control actions that controls or moves the process along to completion. That process gives feedback to the controller, and that's the loop that moves the process around. If you take multiple control loops for the different controllers in a process, you end up with a control structure, and that control structure is just a hierarchical model of system structure and operation. A key take-home point here for me is that there is no explicit time order in this control structure. It is implied in how the control loops are related to one another and what information is needed at one point, but it is not tied explicitly to the description that we see here like it is in a process map. So right from the get-go, you could see this is a more realistic way to describe a complex system, because we know that very frequently steps don't always happen in the order that they're designed. It's kind of the, work is imagined versus work is performed. So the next step in an STPA is determine control actions for the control loops that you're developing. So who or what is controlling who or what? And we're going to look at the parent as a controller. So the parent sets rules and limits for the boys. The parent, another control action for the parent is to stop the boys' play if it gets too out of hand. And then there's feedback coming back to that parent, whether the boys acknowledge the rules and limits or whether the audio visual feedback that the parent is getting about the boys' play. We're also going to look at the control loop of the boy controlling the surfboard. So the boy transfers weight on the surfboard, gets the surfboard to move and go off the bed, and that moving surfboard is feedback for the boy. So we'll just look at these 2 particular control actions, one for the parent, one for the boy, just to make it simple. In order to analyze those control actions, we follow a well-defined steps to do that. So first we ask, how can each control action be unsafe? And we ask ourselves these 4 questions. What if the control action is not given incorrectly, given at the wrong time or order, or applied too long, stopped too soon? After we have a list of unsafe control actions, then we ask ourselves, what are the scenarios that lead to those unsafe control actions. And that's what we're going to describe in the next 2 slides. And so just a reminder, we're looking at the parent control loop, and we're specifically looking at the control action of stopping the boy's play if it gets out of hand. So how can the parent stop the boy's play, be unsafe? How can that control action be unsafe? So here are 2 examples. One is the parent does not stop play when the boys are about to fall. Another is the parent allows the play to resume before a boy's injury is healed. Let's say they got hurt and they wanted to get back in the game, and the parent allowed that play to continue before the injury was healed, creating a hazard that could lead to an accident. So now we ask ourselves, what are the causal scenarios that could lead to these unsafe control actions? So for the first unsafe control action, you could have a family dog that gets incited and jumps at the parent, distracts the parent, parent's not able to stop the play. Or as we see here, the parent takes a photo to capture the moment, which also could distract the parent. For the second unsafe control action, the parent incorrectly believes that a boy who was previously injured is actually healed and ready to go back, maybe because the boy told the parent that, hey, I'm all okay and ready to go. So in this case, the parent is going to have, an incorrect, they're getting feedback and their process model isn't able to accommodate the incorrect information that they're getting from the boy. So let's go on to the boy control loop and analyze transfer weight forward. So following the same thing, how could the boy transfer weight forward be unsafe? A couple of unsafe ways that could happen. Boys apply too much force when starting to slide, or a boy overcorrects their weight transfer during the slide. And these can be unsafe in a number of ways. Something that applies to both of those is the experience level of the boy. Either the boy is inexperienced in surfing off the bed, or they could be experienced but not familiar with new equipment like a new surfboard. Related to the boy applying too much force, the boy could be inherently a risk taker and are always going to end up in that type of situation of applying too much force, being too aggressive. And then this related to the second unsafe control action, boy overcorrects weight transfer, the boy might be scared of getting hurt. And so that could lead to that unsafe control action. So the next step for us now is to devise mitigation strategies for all the unsafe causal scenarios that we discovered in this process. So we have pillows, because if you could imagine for the boy surfboard control loop, if the boy is scared that they're going to get hurt, putting pillows there would mitigate that. But we also have a number of recommendations for the parent as well, where activity, have the activity in a closed room, don't take any, so they can't be bothered by the dog, no photos, or the parent can do some practice with the boy first to deal with the experience issue. So another important point to make here is that this hierarchical nature of STPA is kind of evident here, where FMEA drives your thinking right to the point of where the action's happening, but STPA allows you to kind of zoom out in this case and look at the broader picture and see, hey, the parent actually has a role in safety related to what's happening in this particular scene. Some observations that we can make between FMEA and STPAs. So FMEA is very clear. You're looking for failures that lead to harm of some severity, whereas in STPA, you're looking for conditions that lead to hazards, which then may lead to accidents. FMEA uses risk that depends on occurrence probability. The thing to mention there is that occurrence probability depends on many factors. And if you're talking about an electromechanical device, you might have a very well-defined definition of probability of how long it takes a component to fail. But when you're talking about a process that includes human, really probability has no role there. So what you end up doing is just coming up with a fictitious number that you have no way to validate whether it's actually correct or not. And furthermore, it depends on scenarios. If you come up with an occurrence probability, it may apply at Tuesday at noon when everybody is sharp, but you take that same situation and move it to Friday evening at 10 p.m. when everyone's tired after a long week, and it's a completely different probability profile. So STPA doesn't use probability in the analysis at all. I think in part because that probability isn't a realistic number that you estimate. So the goal with FMEA is to rank order results based on risk. And the goal of STPA is to really understand those scenarios that could lead to accidents. And for the bit of teaching that I've done related to FMEA and STPA in my part of healthcare, if you give people this type of training and you split two groups and you have one work on FMEA and the other work on STPA, the FMEA group spends 80 to 90% of their time trying to come up with the right numbers for occurrence and detectability and severity, where in the STPA group, they're just talking about how to understand the scenarios that lead to accidents. So it drives thinking in very different directions. Lastly here, FMEA treats safety as a probabilistic component failure problem. And STPA treats safety as a hierarchical problem of control. So this kind of is the essence of where the difference between thinking that one has between using FMEA and STPA to analyze a process or a piece of equipment. So I'd like to talk about a couple of papers that were published in the radiation oncology literature related to STPA and FMEA. One that Nancy and Aubrey, this was before the Williams was added, so it's just Aubrey Samost here. And then Derek, Ryan, and Guaya or Grace worked on this paper as well from my place. So we analyzed a process that wasn't created yet, and to see what the safety implications were. Aubrey, Nancy, and I worked on the STPA. Derek, Ryan, and Grace worked on the FMEA part. And I just wanted to pull out one table from that paper, and that compares the results of STPA and FMEA. And first thing I want to point out is that STPA found causal scenarios. I know causal scenarios and failure modes are not the same thing, but just to give you an idea of the number of issues that come up, STPA found about a little over 3.5 times more than FMEA did. Human behavior was a difference. A lot of the FMEA looks at the human and says, the human failed, and therefore that's a failure mode. STPA drives your thinking in different directions, and we didn't attribute as many issues to human behavior. And then organizational management is another big one. So again, FMEA really focused, once you get that process map, you're so focused on what the steps are in order to get the job done. You're not able to zoom out and look at what the bigger, broader implications are of things like organizational management. So that's where STPA really has a difference. The next set of papers, two papers that I wanted to mention are related to what was a new radiation therapy device a couple of years ago. And so it looks like a CAT scanner. If anybody's familiar with a CAT scanner, the patient lies on the table and then they go inside the donut. And if you take the covers off of that donut, there's a bunch of components in there, and there's a radiation beam that rotates around the patient and hits radiation where the tumor is located, so a complicated device. So there were two parallel, unrelated safety assessments of the system. The first one was on the top there, was using FMEA. Task Group 100 is a document by a professional society that advocates the use of FMEA. And they looked at specifically about acceptance testing and commissioning of the device. And then folks at my place looked at the clinical use of the new system called the Halcyon system using STPA. We did acceptance testing, commissioning, and just the general use of the system. So comparison here, acceptance testing found 38 steps, 88 failure modes. Commissioning was 24 steps, 54 failure modes. And for the STPA, that included acceptance testing as well as the general clinical use of the system. we came up with 385 causal scenarios and 144 unsafe control actions. I wanted to point out the conclusions of these two works. The FMEA paper said that the failure modes identified suggest that quality control measures could be used to improve design of the device, whereas what we found on the STPA side, the device presents opportunities to streamline, reduce, or eliminate some traditional equipment commissioning and routine QC activities and allow others to focus their attention elsewhere in the process. So that led us to start to think that, hey, look, with these new devices coming on board, are highly driven by automation and more sophisticated technology, it's probably the right time to redesign the workflow from a safety perspective. So our next research, and two of my previous collaborators are also, from my place, are also on the call today, Grace and Derek. And so we're going to look at performing an STPA without predefined roles and responsibilities. So the group of people you see on the right there have very specific roles and responsibilities. We'd like to do an STPA without assuming who the players are on the field. Just what are the skill sets and knowledge that are needed in order to make the process work. And then we can use that as a fundamental way to redesign the way radiation therapy is practiced with this modern equipment. So in summary, FMEA and STPA are fundamentally different. I hope that's very clear now. They are solving the same problem. So there's going to be some overlap in what the results are, but they're coming at the problem from completely different directions. Only STPA can account for complex socio-technical systems, and that's in part based by, because the STPA is based on the STAMP accident model, which is developed from control and systems theory. And then lastly, we firmly believe that radiation oncology is going to benefit from an STPA-based redesign of the workflow and clinical roles. So with that, that's my last slide. Thank you very much. Happy to take any questions or discussion if there's time.